Good afternoon, and thank you all for being here today. In August 2019, I announced the city's commitment to Vision Zero, a strategy to end traffic deaths and serious injuries in Houston by 2030 and improve mobility for everyone who walks, bikes, uses a wheelchair, drives, and takes public transit. After more than a year of data analysis, community engagement, and multi-agency collaboration, we are launching the Vision Zero Action Plan today. Houston has historically been known as a car-centric city, but like all great cities, Houston is evolving. Our mobility policy is also evolving as we shift the way we think about transportation. We are committed to prioritizing people over cars and integrating a variety of transportation modes instead of focusing solely on vehicles. We know wider roads and faster speeds will not solve our congestion problems, and we know that our current roads already contribute to the high number of deaths and serious injuries. Today, traveling on our roads results in over 200 deaths and 1,000 serious injuries every year, and that is unacceptable. We cannot expect to change our mobility paradigm if our streets aren't safe for all of us. And we cannot encourage people to use other modes of transportation if our streets don't accommodate everyone. That is why I stand before you with Houston's first ever Vision Zero Action Plan. This action plan lays the groundwork for a strategy that we can and must accomplish. Before we talk about the specifics, I want to bring everyone's attention to the first few pages of this action plan. Listed here are 1,153 names and ages of people who died in traffic crashes from 2014 through 2018. Each of their names is a reason to end traffic deaths. One name is one too many. Our goals are straightforward: create a safe, equitable, and accessible network of streets, make walking, rolling, and biking safe, make connecting to transit safe, make driving safe. Houston's Vision Zero strategy draws from input from multiple departments and partner agencies, including planning, Houston Public Works, Health, Police, Fire, the Office of Persons with Disabilities, as well as our partners at Harris County, Metro, and TxDOT, social justice and multimodal transportation advocates, and the private sector. Most importantly, it draws on community input. We received over 2,000 comments, so our community made it clear that safe streets are a priority. They told us that speeding is their top traffic safety concern, and they said that creating a direct, connected network of sidewalks and crosswalks is one of the first actions the city should take to make our streets safer. They told us to rethink the way we talk about traffic crashes. We need to call a crash and stop calling them accidents. Crashes are preventable. The plan presents both quantitative data, including crash reports and traffic volumes, and qualitative data, like dangerous streets and intersections reported to us by our communities. We start by looking at our highest injury streets, our most vulnerable travelers, and our communities that need more attention and investment in their infrastructure. 1/3 of traffic deaths involve a pedestrian, even though less than 2% of residents walk to work. So we start by prioritizing safety over vulnerable road users like people walking and using a wheelchair. Based on 5 years of crash data, we've identified a high injury network of streets with the highest density of traffic deaths and serious injuries. Nearly 60% of our crashes occur on only 6% of our streets. Our data shows 52% of those high injury network streets are in vulnerable communities. This means that our most dangerous streets predominantly affect low-income residents and people of color, many of whom rely on walking or public transit because they don't own their own vehicles. We start by implementing the 13 priority actions identified in this plan, such as constructing at least 50 miles of sidewalks and 25 miles of high comfort bikeways each year. redesigning 10 locations on the high entry network every 2 years, and implementing reconstruction the following year. Determining vehicles' speeds that are safest for all people, using the street, and then designing the street to support that speed. Evaluating every city roadway reconstruction project for multimodal safety needs and opportunities at project inception, and implementing a citywide communication campaign on street safety to celebrate the reality that people use different modes of transportation to get around Houston. I call on city departments to continue working collaboratively to ensure that this plan isn't just another document, but that it delivers transformational change to our streets, ensuring safety for everyone. The city believes in safe streets, and we hold ourselves accountable for implementing this plan. Lastly, together we can create change. Together we can shift how we see mobility and not only see the vision, but make it possible. No loss of life is acceptable on our city streets and highways, none, absolutely none, zero.